One tells you advocacy begins with you. Hello, and welcome back to your new favorite early career podcast, No One Tells You This. I'm your host, Mackenzie Simmons, and I'm so excited you decided to tune in as we continue to uncover the unexpected yet real truths behind early career nursing. On today's episode, we are taking a deeper dive into what advocacy truly means and the immense impact it can have on your career, your patients, and nursing as a whole. It is vital that all nurses understand their individual role in nursing advocacy. As an early career nurse myself, I understand that it may seem daunting to advocate, but don't fret. We want to guide you in your journey to become a confident and proficient nurse advocate. You may hear it said in nursing school or in nursing leadership conferences that nurses are patient advocates, but no one really tells you what it looks like at 2 a.m. when a provider brushes off your concerns, or when a family member is crying in the hallway, or when your gut says something isn't right, or you continue to work with unsafe staffing ratios, or when your patients are affected by new legislation. And you may be thinking, I'm a new nurse. How could I ever make a lasting impact for my patients or nursing? And that's why we are here to tell you that the secret behind advocacy is you. Advocacy truly begins and ends with you. No one else can make a bigger impact on your passions than you. Let's get into it. Hello. On today's episode, we have special guest Ryan Moran to join us today.
Hey everyone, I am so excited to be here on the podcast today. I was excited, Mackenzie, to hear that you were starting this podcast, especially aimed at new graduate nurses. I'm sure it's great for everybody, but I still also consider myself a new graduate nurse, but it's been over 5 years now. But I think I'm still in there. The topics you're covering and the conversations you're having are definitely really important. They need to be heard. They're not necessarily completely covered in nursing school, just because there's so much to cover in nursing school. Everybody's always focused on passing your classes, graduating, passing your NCLEX, getting a great job. And then when you get on the job, you realize there's much more to it than what you learned in school. So I'm glad that you're doing something like this and that FNA is supporting it as well.
Oh, 100%. And, we can always learn something, so maybe we're all early career nurses. So, Ryan, tell us a little bit more about your background and why you became a nurse and where you are today in your nursing career.
Yeah, absolutely. I always knew I wanted to go into some career that helped people. I soon found out that that would be healthcare. My mom's been a nurse in various bedside and administrative roles for the past 35 years. She's always been an inspiration to me. But when I began my undergraduate career at University of Florida, tried to kind of keep an open mind as to what I wanted to do. Part of it also might have just been like teenage rebellion, like I'm not going to do what my parents are doing or whatever. But I eventually found nursing. But to start, I took a bunch of pre-health classes, joined different pre-health societies, clubs. But what solidified nursing for me was I started volunteering at Florida Diabetes Camp with some of my other friends in college when we were all kind of trying to figure out what we wanted to do with our lives. And as counselors, we collaborated with nurses, school psychologists, dietitians, endocrinologists, all to help kids learn how to manage their diabetes, basically through carb counting, insulin pump management, and how to just adjust to the changes in their daily lives that accompanies a new diagnosis of type 1 diabetes. So that was my real introduction to nursing, learning that nurses are not only just medication administrators, but care coordinators, patient and family educators, rehabilitation specialists, and advocates for their patients. Advocacy. There you go. I decided to pursue nursing in my junior year of college. So completed all my prereqs at the University of Florida, graduated with a degree in psychology in 2019. And 2 days after graduation, started my accelerated nursing program at UNF. So I graduated with my BSN from UNF in 2020, and I worked in the medical ICU at Mayo Clinic here in Jacksonville for the following 5 years. So currently back at UNF pursuing my DNP in nurse anesthesiology, and that's where I'm at now.
That's amazing. I loved hearing about your background. It seems like you've got a strong background, beneath you and just a great foundation and something we can all truly learn from. So we are thrilled to have you, and we're gonna just, take this journey on advocacy. Let's get into the episode. So, Textbook definition of advocacy means protecting, supporting, and speaking up for your patient's rights, safety, and wishes. Advocacy does not stop when your shift ends. We learn in nursing school that nurses are the patient advocate and to always speak up when we have a gut feeling that something isn't right or when we know we could take better care of the patient. It typically isn't expounded on what the feeling feels like, what to do, or just even how to advocate. But you can be wondering, how in the world can I ever make a difference when I'm not even sure how to speak up, when to speak up, or why? Nurses are also advocates in the system, the community, the policy, the state and national level. So, saying all of this, Ryan, what does advocacy mean to you?
So advocacy means a great deal of things to me. There's personal, social, political, professional advocacy. They all play an integral role in nursing, whether we recognize it or not. Even bringing it back to those early experiences at Florida Diabetes Camp that I was talking about, seeing how kids as young as 4 or 5 years old adjust to a new diagnosis of type 1 diabetes and they're forced to become experts on their own disease, they kind of shows you how early on um, important it is to have people around you advocate for you, family, friends, community members, healthcare professionals. That's where we come in. And that's great interpersonal advocacy that we can engage in both at work and in our own lives with our friends and family. But not everybody has access to these resources. And that's where social and political advocacy also comes into play in nursing. So, advocacy at its core of all kinds really is like a resource allocation issue. For example, imagine there were an uptick in hospitalizations for those pediatric type 1 diabetic patients due to disease mismanagement, secondary to lack of education or access to education, or lack of primary care in an underfunded area. It might be helpful for advocates to encourage investment in educational programs such as Florida Diabetes Camp to allow more pediatric type 1 diabetics to learn how to live with their condition. This theoretical increased investment in type 1 diabetes education would be a proactive and preventative strategy to avoid the reactive potential hospitalizations that it could protect against and avoid all those related sequelae like cost, stress, healthcare system burden, mortality, etc. And something like this could be accomplished politically at the state and local level. And as I'll explain a little later, nurses can wield serious political influence at all levels of government to help patients and community members.
That's so amazing to hear. And thank you for sharing how close advocacy is tied to your own personal and nursing life. So, we learn about advocacy in nursing school, but don't truly learn the importance until practicing in action, either at the bedside or the system level, getting involved in councils, or attending advocacy day. When did you first realize that advocacy was a major part of nursing, and why did you desire to get involved?
So I actually had the privilege of getting involved in my Student Nurses Association as an undergraduate at UNF near the end of my first semester in my BSN program. And this is kind of where I first learned about professional advocacy. That is, the issues that RNs and APRNs are experiencing in the workplace, from workplace violence to unsafe nurse patient ratios to the nursing shortage, patient safety concerns, allowing APRNs to practice the full extent of their training and education. So that was a great experience. And while membership or activity within SNA or the Florida Nursing Students Association was encouraged by the program, it wasn't required or anything. But even built into this undergraduate programming were a couple of really cool things. For one, we had a class on community nursing. We looked at how nurses could play a role in public health and how nurses could implement health education programs, work in community health clinics, and inform the community about public health initiatives like the importance of receiving the annual flu shot. Also had the opportunity as an undergraduate to volunteer with our local chapter of American Red Cross. This is a partnership the university's had for a few years now, and our primary work during our time there was actually the home fire campaign, where we would install fire alarms in the houses of those who requested them. It was really cool because you don't really think about that as a public health initiative, but it really is.
Yes, 100%. And I love that you shared that you got involved as a student. So, do you believe that nursing school prepared you to be a proper nurse advocate? And how did your view of advocacy change over time with your experience?
I mean, I really do. I feel like my program set me up for success in terms of nursing advocacy, and I think a lot of programs are beginning to follow suit. As the field of nursing grows and nursing education extends further into the master's and doctoral realm, I think nursing schools are looking to start educating the next generation of nurses on topics like leadership, advocacy, public health, health policy, and those other disciplines that aren't necessarily traditionally associated with nursing, but they really should be.
Yes, I definitely agree. It is becoming quite the hot topic, and it really does need to be. Voices of nurses need to be out in the public because we are, trusted professionals. So every nurse has their own individual experience with advocacy and how they have navigated different challenges. Can you walk us through a time when you advocated for a patient, how you were able to, and how that experience changed the outcome for the patient?
Yeah, I'm sure every nurse can probably think of a million things that they've done that would might be considered advocating for a patient, because advocating for one's patients is kind of at the core of nursing. And I think that's something that most nurses understand, but it's hard for the public to understand. And what I mean by this is you take an average shift to the hospital as a med surg nurse. You might have anywhere from 4 to 8, hopefully not more, my goodness, patients requiring varying levels of assistance. And oftentimes you're kind of put in these impossible situations where you have to choose who to help first based on a hierarchy of needs. And this might not mean there's multiple patients, crashing at the same time, but it might mean something like one patient needs a lot of help and another patient is really uncomfortable and in a lot of pain, and they might have to wait sometimes hours to be seen. And that's obviously, a terrible decision that people are forced to make. And then oftentimes you need to advocate for certain interventions to be done. So, for example, if you know your patient who has been hospitalized for weeks or even months, I saw sometimes in the ICU, they would benefit from a trip off the unit and they were stable enough, you might try to advocate to get the resources to do that. I had the privilege of working in an ICU that was mostly adequately staffed for the majority of my time there. And for our patients on some advanced devices like ECMO, we had 1 to 2 nurses working on the same patient because it required just a lot of advanced training and, they're hemodynamically unstable sometimes. But some of these patients were well enough where we actually could take them outside with enough staff members. So, especially the ones that were there for months at a time, we would really try to at least, once or twice a week, give them something to look forward to and be like, hey, I know you're really going through it. I know you're already seeing, people from social work and we're working with PT and OT and everything. But how great would it be if we can go outside tomorrow? Like we can make that happen. And, these patients can be busy, but an important part of their recovery is physical rehab and promoting mental health and well-being. That's something that isn't talked about a lot for our patients. We talk about it a lot now for nurses, but our patients are going through it too.
100%. And as nurses, we want to provide that holistic care. I can definitely think of a time when I took a patient downstairs right before his open heart surgery because he was so nervous that he
Yep.
would never be able to step outside ever again. He was like, if something happens, I want to step outside one more time. And
Oh,
it took
wow.
some convincing to get the doctors, on page, but
It's hard to do
I'm
sometimes. Yep.
really glad that he was. And he ended up coming out the other side of the surgery and is very healthy now. So I'm glad I was able to give him that experience.
That's
So
awesome.
there are times when nurses may look back on a situation and think, oh, I really wish I could have done more, or I wanted to take action, but I wasn't sure where to start. Have you ever regretted not advocating for a patient? What did you learn from this experience? And how do you approach new challenges because of this?
I think this is a feeling felt by many nurses, regardless of experience level. But this really reminds me of being a new graduate nurse and not knowing when it was okay or appropriate to speak up, especially if you're afraid of potential repercussions. My piece of advice would definitely be, if you see something that you don't believe is safe, say something, clarify
Hmm.
what you think you're seeing. People aren't often recognized for successfully preventing a mistake or an accident, but your patients and your hospital and your hospital's legal department and risk management, they will thank you for speaking up nearly 100% of the time, because it shows that you have the patient's best interests at heart and the needs of the patient come first.
Course, 100%. And a lot of the things can just be, prevented by advocating and making sure that your patient's wishes feel heard at the bedside and, that they feel like you listen to them and that you want to provide them with the best care possible for their particular wishes or desires or culture, religion, whatever it might be. Have you ever received pushback when advocating, and how did you deal with this challenge?
Well, when I worked in the ICU, there was a quality improvement initiative. I was our quality improvement chair for our unit, and I took a special interest in infection prevention because when I had first joined the unit as a new grad, we had just experienced kind of a big uptick in infection rates, and this wasn't a massive thing. It was more just like the prior couple years were really good with low infection rates, and then with the onset of COVID, and we were peaking with our COVID cases, and we had just converted to being a COVID ICU, good bit of staff turnover, a lot of new grads. We were just, it was kind of a perfect storm where we had to implement some evidence-based interventions to try to help our patients. So increasing CHG bathing, re-educating staff on importance of disinfection, the correct wet dry times for alcohol and bleach-based products, and ensuring all lines, drains, and tubes and meds are capped with those antimicrobial caps. Whenever somebody comes in with a practice change, there's going to be pushback. It causes a
Of
brief
course.
disruption in workflows sometimes. So people, get into their routine and they don't want to change stuff sometimes. But you still have experienced that pushback sometimes. But honestly, most successful practice changes, they end up receiving the support of your fellow staff after positive results are identified from those changes. And something really important that isn't shared a lot, you have to share these findings because if you don't share
Yes.
the fruits of your labor, like people are just going to think, oh, we just it used to be so easy back then, now we have to do all this extra stuff. Like, well, no, if you prove that it's beneficial to your patient, then you might get some more buy-in. So when it came to that daily CHG bathing that I was just talking about, I did some chart audits and found that we weren't super great on ensuring that patients were getting their daily CHG bathing. And in the ICU, in patients with central venous access, like the evidence basis is every 24 hours, they should receive full body CHG bathing. So with some resource support from leadership, I helped lead a hospital-sponsored QI project aimed at educating nurses about the importance of daily CHG bathing and then the potential adverse effects of missing it, including, central line-associated bloodstream infections or CLABSIs, and kind of like the adverse effects that can come from that. I mean, the mortality rates are very high on that, the cost to the patient, the cost of the hospital. These are all considerations, but there was some pushback. People would say there's not enough staff to make sure these things are done, not enough time. So we kind of made the case to leadership that with infection rates rising, the cost of adding one more patient care tech per shift or one more resource nurse per shift that might have some extra time to help out with these things. It's an easier fix and less risky, less expensive than allowing patients to contract healthcare associated infections. So within a few months after this intervention, our unit-wide rate for CLABSI had decreased by over half, and our daily CHG bathing had nearly doubled. So when you share this information with your team, you might get more buy-in and less or no pushback. But if I had one piece of advice on how to successfully get buy-in from leadership on a proposed practice change that you have, go to them with two things: research and the financial impact of your proposed intervention, because that will
Mhm.
answer every question they have.
Yes, I could definitely agree because they always, want to see how it's going to impact the business of the
Mhm.
hospital. Unfortunately, hospitals are businesses nowadays, and it's so important to, see how this is going to overall play. Or for my hospital, it's a lot of, oh, what is the other units doing across the hospital? How would this change, the whole hospital or the enterprise, for
Mhm.
example, so it's very like important, to go in and say like, hey, this would actually like impact us in a positive light and, lead to better patient care, less infections,
Yep.
that's so important. So I'm glad that you shared you got involved very early on because I know a lot of early career nurses think, oh, like I can't speak up because I've got no experience. But no, it's just important to lean in and to say yes because you are the only one who can do something about, your experiences and your push with advocacy.
Absolutely.
Yeah. So, advocacy is vital at the bedside to ensure that all patients receive adequate care. However, nurse advocates are highly valuable beyond the bedside as well. Can you share with us how advocacy spans beyond the bedside and how you have personally engaged?
Yeah, for sure. We'll talk a little bit later about how the Florida Nurses Association and the ANA advocate kind of beyond the bedside and how I've been involved with them. But I'll let you know about some of the other stuff I've done. And anybody can do this. It doesn't have to be nurses, doesn't have to be, it could be you and your friends, you and your family. But I've helped put together some community cleanups with local organizations in my area. I have volunteered with this really cool organization called Three Grains of Rice that helps collect unused medical supplies from hospitals and sends them to under-resourced countries. So that's very cool. Shout out to them.
That's amazing.
I've also
Wow.
volunteered with National Nurses United. This is the nation's largest nurses union. I've never had the privilege of being a union member myself, but I've been a volunteer for many years, just data entry and like phone banking and text banking for initiatives that they're passionate about. I've also volunteered on some political campaigns and collected signatures and canvassed for ballot initiatives. My kind of big thing that I am working on this year and the next few years, just in whatever spare time I have, Medicaid expansion is trying to get on the ballot in 2028. So that's
Mm.
something that's supported by the American Nurse Association as kind of a cost-effective way to close this insurance gap. And what does the insurance gap mean? So currently in Florida, you have to earn less than 28% of the federal poverty line to qualify for Medicaid. This is for a family of three. This is like
Wow.
$7,000, like really low. So that's very serious poverty. If you earn more than that, but not enough to afford health insurance through the
Mm.
marketplace, which is quite expensive, or if you're in a job that doesn't offer health insurance, which is the case for many of those with lower incomes, you might find yourself in that situation where you have too much money to be insured through Medicaid, not enough money to afford marketplace insurance, and then you're in that limbo, that coverage gap. So
Yeah.
Medicaid expansion in Florida would kind of increase that income limit from 28% of the federal poverty level to 138% of the federal poverty level, meaning hundreds of thousands of those in Florida that are stuck in that insurance gap would be eligible for Medicaid coverage. So that's huge. The kicker is 90% of that cost is already allocated by the federal government
Mm.
as of the passage of the Affordable Care Act, 16 years ago. The state of Florida would only be responsible for 10% of that cost. Floridians as a whole would save a bunch of money because newly insured people would seek preventative and proactive care rather than expensive and reactive care for serious illnesses that they, put off signs to, previously. And less people would be using the ER as their primary care, which is a huge thing that we're seeing increasingly throughout the past couple of years. And Florida is one of the few states that has not expanded Medicaid under the ACA. And
Hmm.
something that's cool is it enjoys bipartisan support. Florida Nurse Association is a nonpartisan organization. Floridians would save money if it were implemented, and ballot initiatives are pretty cool because it's kind of like direct democracy, or the closest thing we have to it. And I'll get off my soapbox with Medicaid, but so if something like that's not your cup of tea, I mean, I honestly recommend just going to your local city council, go to your local school board, see what the big issues are, the big things that are happening in your community. I'm part of some local groups here in Jacksonville that let people know like what's going on, what legislation is being considered at city council, or what new rule is being proposed at a school board. You're able to just speak during public comment if you feel so inclined to speak on behalf of or against any proposal in your community. I highly recommend you go at some point. You pay their salaries, so they have to listen to you. But yeah, I encourage all nurses to find something they might be interested in beyond the bedside. Just because the nurse's input is very valuable in a lot of these domains. And if you're not at the table, you're on the menu. So,
Wow, that's honestly so inspirational how much you've leaned into advocacy beyond the bedside and at the bedside. And, for early career nurses listening, it's as simple as going out and volunteering in your community. There's so many people that need our assistance, that need us to just say yes and take that first step. And if you don't know where to go, take his recommendations, go to the city council, the school board, any community organizations, and bring a friend. You don't have to do it alone.
mhm,
There's always going to be someone who wants to take you under their wing or a best friend who wants to get involved. Nobody like feels comfortable going alone at first, most likely. I probably wouldn't.
mhm.
So, the biggest thing is, get more people involved, speak up at your hospital, whatever you can do to say yes to advocacy is so vital and so important. And, I'm just really inspired myself, like, of all the outreach you've done. So, what is the biggest difference between this form of advocacy and the advocacy we see at the bedside?
Yeah, so that kind of brings us back to those differences between interpersonal or individual advocacy and more systems wide advocacy. So you've got the individual advocacy, advocating for your patient to be seen by PT or OT or dietary, even though everybody's super busy, or for a post surgical patient to have the best chance at the best outcomes by going above and beyond to ensure early ambulation or feeding or helping them complete their ADLs, even when you're busy. So while we as individuals can go to great lengths to advocate for our patients by ensuring they receive the best care possible from us and our coworkers, it's only one part of nursing advocacy because we should extrapolate these principles to more system-wide changes. So advocating for safe staffing ratios at our own facilities or to ensure patients aren't missing out on care they should be receiving from, nursing or PT or OT or social work, joining your unit council, joining hospital-wide subcommittees that often underrepresented in the realm of nursing. Just being that nursing representative there adds a lot of, it just adds a lot from the bedside that often isn't talked about. And we have to extrapolate that to the socio-political realm as well, advocating for FNA's legislative priorities, for example. So small acts of individual advocacy are important, they're great, they're necessary, and they save lives at work every day. But if we want to make an impact not only on our individual patients, but on all our potential patients, like the community, our state, our country, we have to be advocating where laws are made and regulations are set as well.
Yes, exactly. So, even though we're seeing an uptrend on nurse advocates, people speaking up, it being embedded in different nursing programs, whether that be at the doctoral level or the bachelor level or your basic associates. However, what if nursing advocacy became a thing of the past? What do you think healthcare would look like without nurse advocates? And how should this change new nurses' perspective of advocacy?
Healthcare without nursing advocates would be disastrous. We've already experienced such a flawed healthcare system as it is. When compared to other, OECD nations, we consistently rank low in access to care, affordability, life expectancy, administrative efficiency, maternal mortality, and we spend a lot more money than these other countries as well. It's often said, but nurses are the backbone of the healthcare system. We are by far the most numerous of all of those that work in healthcare. We number in the millions just in our own country. There's hundreds of thousands in Florida, even. We work in a variety of roles in every type of healthcare setting. We truly have our hands in every part of healthcare. So without nurses making their voices heard, our work remains individual rather than systems wide. And then our
Mhm.
influence on the public well-being is stifled. So to new nurses, I want you to know that you do have the power and influence when you join up with other nurses and advocate.
Yes, it's so true. And that's one thing I love about nursing is that we are stronger together. And oftentimes nurses are all about teamwork. It's comes on those days when, you need someone to help you and, you get your, best friend at the bedside to help you turn a patient or,
Mhm.
you're going to advocacy days with a good friend of yours. I really love, how nurses just bond together. And, there's so many seasoned nurses out there that truly do want to take new nurses under their wings.
Yeah,
So always be looking out for that. New nurses definitely go after, those seasoned nurses say, how can I learn more? Because I'm telling you, if you lean in, they will help you. They want to teach you. They're so excited you have been welcomed into the profession.
absolutely.
And from leadership opportunities to continuing education and real world support, FNA helps you grow, connect, and find your voice as a nurse. Join us today and start building the career and community you deserve. Visit floridanurse.org today to become a member. So, we have a host of new nurses listening to the podcast because we are the Early Career Podcast. How do you recommend they begin their journey in advocacy, and what is a small step that they can begin their own journey?
So I love talking about kind of specific calls to action whenever I have conversations like this. So we'll start with something easy, kind of low barrier to entry. So the American Nurses Association, their advocacy arm is called RN Action. And they are constantly monitoring nursing related legislation and regulatory changes in Washington. They always have at least a couple of action items that you and I can do right now to help advance ANA's legislative and regulatory priorities. And it usually
Great.
only takes a minute or two. If you go to the website ana.quorum.us or just go to ana.org and click on practice and advocacy, you'll see a couple of very specific calls to action. Submitting a comment to the Department of Education to let them know that nursing should be classified as a professional degree. You've probably heard all about this recently. This was kind of a big deal because it
Hot
limited the
topic.
amount. Yep, limits the amount of loans that advanced practice nursing students can take out for their education, which will prevent a lot of people from pursuing that higher level of education. And the easy thing about this stuff is they really, ANA, they do all this research. They put all of your, information that you need right there. They write the bulk of the letter for you, and you just add a little tidbit about your own perspective on it, and then you can just send it right in. That's why it only takes a minute or two. But it's important to hear from nurses, and they really do take these things into consideration. But there are other things on there because that campaign is wrapping up soon, and I hope that we get a resolution on it in our favor as well. But there's
Yes.
plenty of other things on there as well that you can write a letter to Congress to encourage the support of the Workplace Violence Prevention for Healthcare and Social Service Workers Act. So you could send a letter to Congress denouncing the killing of nurse Alec Pretty in Minneapolis. You can write a letter to Congress to support the Improving Care and Access to Nurses, or the ICANN Act. That would remove unnecessary practice barriers for APRNs working in rural communities or healthcare deserts. All of these are simple, kind of couple of click kinds of advocacy that you can engage in, and you can maximize your impact by encouraging your classmates, your coworkers, your friends, your family to fill these out as well. It doesn't have to be nurses only. It could be, community members that are friends with nurses or family with nurses. Um, those are some low barrier to entry opportunities, but here's kind of a bigger ask. Join an FNA interest group. Go to floridanurse.org and take a look at each of the 8 special interest groups that FNA has. There's a health policy one that meets monthly. There's ethics, public health, justice, diversity, equity, and inclusion, nursing research, holistic nursing. There's so many different things. You can even start your own one if you want. As long as you find a couple of people to start it with you. You can find all this info on floridanurse.org. These are monthly meetings, generally on Zoom, where you can meet FNA members either in your area or all across the state.
Wow. So you're saying that I can do advocacy on my phone in my bed?
Indeed.
That, is so easy. So I challenge everyone listening to this podcast to do at least one step, whether it be logging online, joining one of our FNA special interest groups, going to the next meeting, or just, doing the two-click action with ANA. Even the teeniest bit of advocacy can make the biggest difference. So, it's not that hard. It can feel, daunting at first, but just small steps will grow your confidence, and then maybe you'll be doing big things one day, maybe even running for Congress. Who knows? The, limits are boundless. So these are just some amazing resources and initiatives. Ryan, can you share your personal involvement with FNA advocacy specifically and how it has shared your view in your own personal advocacy?
So my involvement with FNA actually began as a student. So while I was pursuing my BSN, I had the privilege to serve on the Florida Nursing Students Association Board of Directors. I was the chair of the Northeast Florida region and the chair of the Legislative Advocacy Committee. So in this capacity, I attended advocacy days for the first time as a student. That was in 2020. January of 2020. So it's right before everything kind of changed.
Very
It was
interesting.
an amazing experience. That was actually the year that I came in. It was my first advocacy days. I was learning all this stuff. I was finding out all of these nurses that have been fighting for decades for advanced practice registered nurses to be able to practice independently in the state of Florida, and that happened to be the year that it passed both chambers and was signed into law by the governor. After getting the thousands of hours of supervised practice and then applying for your license. But now we do have thousands of APRNs in the state of Florida that do practice independently, which is awesome because it really helps our rural communities, because that's where APRNs kind of really fill those healthcare gaps. So that was great. It also felt like kind of a cheat code because it was my first advocacy days, and we got it like our biggest win ever. So, uh, but I've
That's
attended
amazing.
multiple advocacy days since 2020, and it's been a really special time every time.
That's great. I am so excited that you shared that you got involved as a student. I personally also got involved as a student, but my action was more with NSNA instead of the FSNA. But I was, an active member of both. And honestly, like getting involved in the student organizations 100% jumpstarts your career. So if you're listening as a student, get involved now. There is no reason to wait, and if you're nervous, it's okay. You can always reach out for support, guidance, advice, and all the students listening out there, you can also get involved in our early career nurse SEG, which is a special interest group all around, early career nurses. We are excited to help you, excited to lean in with you. And talking more about advocacy days, it is absolutely one of my favorite events by FNA. I actually recently attended my first advocacy days, and it was so exciting. I was so nervous to talk to the legislators, but they're just people like us,
Mm-hmm.
and it became more natural, and I'm so excited myself to just lean in so much more. So, can you explain a little bit more about what is Advocacy Days if, the audience hasn't heard? What's its purpose and why do you feel compelled to go and join year after year?
Absolutely, yeah. So during each legislative session in Florida, FNA gathers hundreds of RNs and nursing students. We go to Tallahassee and we discuss priority legislation affecting nurses in our state. We discuss that amongst ourselves. We kind of settle on our big points that we want to hit when we talk to legislators. And then we go to the Capitol and we speak with, state legislators, state senators, the ones that are considering this legislation, and we share our opinions. We attempt to provide them with our unique experiences and our reasons behind supporting or opposing a given bill as an organization. So when legislators are considering whether or not to support a bill or to sign on to a bill, they consult subject matter experts. In the realm of nursing and caring for patients, and to an extent educating nurses, we are the subject matter experts. You might
Hmm.
not feel like that if you're a 22 to 25-year-old new grad, but it's really true. With the exception of state senator and FNA member Dr. Barbara Sharif, the legislators that we interact with do not know more about nursing than you do. They do not know more about caring for patients as a nurse than you do. You are the subject matter expert. This knowledge is a superpower when conversing with and educating legislators. They want to hear from us. This is a good time to remind, like, FNA is a nonpartisan organization. I mentioned that earlier, but we represent the professional interests of almost 400,000 nurses in our state. They all come from different backgrounds, creeds, religions, political affiliations. But when we're all advocating in Tallahassee, party affiliation more or less goes out the window. We're doing it for our patients.
Hmm.
Um, yeah. So, like I mentioned, we have 400,000 active nurses in the state. We're a full 1.7% of Florida's population. We are huge, but only a few hundred people come to advocacy days. I mean, even fewer are involved in kind of the year-round meetings that kind of we do with our legislators here at home as well. So you as an individual can really punch above your weight and make a huge difference if you come out to something like that.
Wow, I didn't even know that there were that many active nurses in the state. And
So my
I, encourage spread the word. Spread the encouragement to get involved and why and how it has impacted your personal practice. I know being at Advocacy Days, it was so cool to watch the House passed several of our bills. We got to watch three of them pass, so that was very exciting. And, I just want to lean in further and learn so much more. And I encourage all nurses out there to, just lean in. We have a nurse in office, Senator Barbara Sharif, and she's excellent. I got the privilege and the honor of meeting her at the past advocacy days. And, I'm just truly inspired by her work, as a nurse and as a senator. So, a nurse can run for office, which is incredible and it's so exciting. Are there any particular bills being supported by FNA this term that you are super passionate about in particular?
Yeah, absolutely. So, a big bill that has been, kind of supported by FNA, and it's been actually the priority bill for FNA the past couple of years. Also supported by FANA, the Florida Association of Nurse Anesthetists, which I am now becoming a member of. So, this protection from surgical smoke bill, it's really important because basically what we have going on in the operating rooms in most, kind of resourced facilities, um, cautery, or the cutting of skin, uses basically smoke evacuation to make sure that we aren't breathing in all of the carcinogens that come with it. Um, so the way that it used to work is it would just be open air, and it would be like smoking multiple cigarettes every day, and everybody in the OR, including the patient. I mean, for babies being birthed by C-section, it's their first breath. It's something that's not good. Most states and most ORs have adapted to this, and they now have kind of built in smoke evacuation systems into the cautery. But this isn't required by law in the state of Florida. So you
Mm.
obviously have facilities that are not implementing these safe practices. So basically, we found cost-effective measures to ensure that any facility would be able to easily afford this. And FNA's just been trying to get this passed in the state house and the state senate, and it's going to happen. I believe it. Um,
Woo!
there's also a really cool initiative about patient-directed medical orders, or PDMOs. So this is basically saying, there is a difference between your code status and what you actually wish to happen when you are incapacitated. So when you are establishing your code status, full code, DNR or DNI, this doesn't necessarily, delineate. I would like to be a full code, but if I am unconscious and on a ventilator for, over 2 weeks and there is little chance of recovery, then I want this, this, and this to happen. We kind of rely on our loved ones for that. But really just to, get it in writing and really protect the patient's wishes. A lot of states actually have something called patient-directed medical orders, which Florida does not have as a state registry right now, but we're trying to establish it. And this would basically, in the same way that a code document kind of protects the patient's wishes, it more specifically, protects what they want at the end of their life. And it really is going to be good if it passes, I think, because working in the ICU,
Mm-hmm.
I'm sure you've seen a lot of this as well, Mackenzie.
Yes.
Um, you know, we'd like to think that everybody around us always has what we want, first and foremost in the front of their minds, when they're going through end of life care. But there might be disagreements. And if you're not around to advocate for yourself, then it'd be good to get it in writing. So it's passing this bill, the patient directed medical order bill, would just make it, more available for doctors to establish with their patients that, hey, you're able to specifically say like what you would want to happen at the end of your life, more so than just the full code, the DNR, the DNI. So you can protect yourself in this way. And I think that would be great for patients and nurses alike.
Yes, and it would just further protect us. And I like how this bill, would allow us to reach, these wishes no matter where they are across the state, whether going to and from, a nursing facility to the hospital, because, how many times have I seen a patient, receive full resuscitation when they had a DNR in
Mhm.
place, and
Yep.
we weren't able to access it,
Right.
because we hadn't been able to talk with them. So, it's super important. It's actually 45 states, so we are
Yeah.
behind us and
Mm.
four others.
Oof.
So, I love how we talked earlier about how these issues are nonpartisan.
Mhm.
It doesn't matter what political party you're from because these, are big nursing issues. You don't have to, say like I lean this way or that way on the spectrum. It's what has your nursing knowledge taught you and how can you make an impact? So, if you're worried to get involved in political advocacy because you're saying, "Oh, I don't like to get involved in politics," you don't want to cause conflict. That's one reason that I was hesitant to get involved. But,
Mhm.
sharing these, you can see it's very nonpartisan. It's just
Mhm.
what have you learned during your nursing experience, your nursing education that, you need to see a change in. So,
Mhm.
super important.
Yes.
So, burnout is present across various spans of nursing. It is important that we take the proper time to refuel and fill up our own cup before pouring into others. Advocating may lead to an increased strain due to pushback or challenges faced. Have you faced burnout yourself when advocating, and how can nurses avoid burnout when properly advocating?
Oh, I mean, for sure. I feel like, you know, what nurse hasn't experienced burnout? I've certainly encountered people who pour so much of themselves into helping others, they have trouble maintaining, themselves. And I've been there at times myself. I understand. I found that leaning on your friends and family, committing, really committing some time to developing hobbies and interests outside of nursing, outside of advocacy, outside of community work is of the utmost importance. That might be travel, that might be music, that might be going to concerts. You need something. If you want to take the best care of your patients, you have to take care of yourself first.
Yes, and that's so important. I am the type of person, if you know me, and some personal people who are listening to me, they're probably like, yes, she will say yes to every single thing. So this can even look like saying no. And it's okay to say no. Yes, get involved, do all the things, but it's okay to take a day to yourself. It's okay to, say, like, I need personal time so I can better serve my patients, serve my community, and don't feel like, oh, like, I gotta get back out there, it's okay. So, like, take a deep breath and make sure you are actually getting that adequate rest, whatever it looks like, and don't compare your rest to someone else's because your rest might look like going to the gym and someone else's might look like sleeping in,
Yep.
so completely different, but it's what fuels you, so learn, more about like what you get fueled by. So what does a strong nurse advocate look like in 2026?
So, strong nurse advocate in today's society, I think, is somebody who gives their all to their patient during their normal shift at the bedside, but is also part of that kind of shared governance or unit council on their unit, whatever your facility's equivalent of that is. Or maybe you take the initiative to implement a quality improvement project or just promote good habits to the new nurses that you precept. I know a lot of new nurses are probably listening, but you will be a preceptor in due time. I mean, it comes for all of us. Like you gain experience and then you have to share it. That's kind of the deal that we have here. Um, but also engaging in that professional advocacy that we've been talking about. And through any professional organization that you find might fit your goal, FNA, ANA, National Nurses United, you name it. I mean, I feel like we've gone through a lot of different things that one could do um, throughout this podcast. Just find something that you like. Not everything's for everyone,
Hmm.
but yeah, find a way to fill your cup.
I love that. And honestly, I've learned so many valuable lessons about advocacy today myself. Before we close, Ryan, could you just share some wisdom and encouragement with our early career nurses wanting to begin their journey into advocacy?
Yeah, absolutely. I mean, if there's one thing I want everybody listening to this to take away from this conversation, it's everybody, no matter where you are in your nursing journey, from a nursing student or a pre-nursing student to a new graduate to a seasoned 40-year veteran of nursing, everybody has something to add to the realm of advocacy because everybody's individual life experiences are unique And with that unique experience, you bring an opportunity to advocate for your patients and your community and your profession.
Wow, just thank you so much for those words of encouragement, and thank you for everyone for tuning in today's episode. If you enjoyed, please make sure to follow along for more episodes, and make sure to send a friend who needs to hear this episode. And thank you so much, Ryan, for being today's special guest.
Thank you so much for having me. There's also a
If you're interested in getting more involved in advocacy, please do not hesitate to visit the FNA Advocacy page on our website. FNA wants to encourage and support all nurses to become engaged in the policy and legislative process to improve the health status of our communities and the practice and working environments of all nurses. I encourage you to take action and become involved with the nursing advocacy, whether that means speaking up for a patient at work, joining the Florida Nurses PAC, engaging in policy at your local hospital, or sharing this episode with a friend. Advocacy may seem scary at first, but it's vital to growing and advancing the future of nursing and healthcare. So, if no one told you yet, your journey with advocacy starts with you. You don't have to be an expert to start. You just need to take a step forward. No one tells you that advocacy truly begins with you, but now you know. You can be a nurse advocate at any time within your career, but especially as an early career nurse. This is your host, Mackenzie, signing off, and we hope you join in next time to No One Tells You This.